I think it's born out of a bit of frustration with how we doctors and the entire medical profession deal with our mistakes. And I know that over the course of my career, some of my best diagnoses have been made because someone told me a story. Because a colleague or somebody else said, "Hey, I
Correct.
had this case once, and this is what went
Yeah,
wrong,
and you don't forget it.
or
It stays in your
or what
mind.
went right, or this was the twist in the story that you learn." And I feel like there's so much medical legal prohibition of discussing your cases, especially after an error. The first thing they tell you if there's a bad case is don't talk about it.
Right.
Wait for the lawyers, wait for the risk management folks, and do not talk about it. And all you want to do is talk about it. All
Sure.
you want to do is run it through with your peers and think about what you could have done differently and what we can all learn from it. It's in no way trying to violate a patient's privacy. It's simply trying to alert your buddies and your colleagues that, look, this was not in the books. It's like my case of appendicitis with the right upper quadrant pain. Sure, we know theoretically that can happen, but I saw it with my own eyes. And when I tell you, Dean, about it, you're never going to forget the fact that an appendicitis can present with right upper quadrant pain. And so that kind of narrative we lose because we're shut down among ourselves. And so my goal is to write about my own mistakes, which is tricky because after you've read a few, you'll think this guy.
You say, "Oh, Dr. Mitchell got it all wrong now."
Yeah.
Trust me.
How did this guy
The
get
humble
through med
doctor
school?
that's willing to admit their mistakes, that's the doctor you want to go to. I'm just
But you also don't want a doctor who's made too many. And
I
there's
understand, of course.
there's always that balance of, is this a very smart doctor who just made some understandable mistakes, or is it more than that? And so there's always that balance of respect and is this reasonable? But the bottom line really is right now we're blinded to ourselves. And William Osler, the founder of American medicine, the father of American medicine, who was Canadian, there's a quote in his biography of how he would call his students to the bedside, to the autopsy table. He did his own autopsies. And whenever he made a mistake, he would get them all around the autopsy table and show them exactly what he had done wrong, how he had made the misdiagnosis, insisted on all of them learning. And some of them became eminent professors later and said, 30 years later, I remember those lessons that Dr. Osler taught me. And so that kind of openness of just saying, look, it's impossible to know all the variants of disease that you're going to see. The textbooks are often not accurate or often too general. And you need the grist of that reality, the tangible, hands-on feel of what this looked like to me and why I missed it. And that's how you teach young doctors.
You're 100% right. Gosh, you're saying such important stuff. One of the reason I also went into internal medicine, and specialties, I love stories.